term.
More health news this morning. November is Lung Cancer Awareness Month, and lung cancer is by far the leading cause of cancer death for both men and women.
WSFA 12 News reporter Bethany Davis joins us live this morning from Baptist Hospital. Bethany, lung cancer is a disease we all should probably take a little more seriously.
Yeah, lung cancer every year kills more people than any other cancer. But listen to this. If it's diagnosed at an earlier stage, a lung cancer patient has 13 times higher of a likelihood of surviving the next 5 years. This is Dr. William Zalisky, who's been part of Baptist Health's screening process for lung cancer since it's been around about 10 years now. Let's talk a little bit about the screening process. Explain how it works.
Sure, we're so proud of this. We've had it for about 10 years, and we started out with about 240 screens, now up to 1,800. We get our primary care doctors to send us patients that fit criteria, usually between 50 and 80 years of age. They have to be smokers and or stopping for 15 years. They have to be asymptomatic, no chance of having cancer at that time, of course, and they want to participate in the program. They do undergo a low-dose CAT scan, which screens for cancer, for lung cancer. We're picking up nodules now incredibly early. Last year, we picked up 267 potential cancers out of those, which turned out 25 to 30 of those were cancers that we picked up that were treatable and curable.
That number, that 13 times higher of a likelihood of surviving if you catch it earlier, is a pretty big reason why we're pushing, particularly during Lung Cancer Awareness Month, earlier screenings. How big of an impact do these early screenings make?
Well, it's incredible. We are the 10th in the country, Alabama, in screening, which I'm so proud of, and we're going higher than that. And again, studies show that picking up a cancer at stage 1 is significantly improvement in outcome. So we're so proud of that. So once we do get them screened, then we get into the process here with Baptist Hospital and the Cancer Center and get into the process of making that diagnosis.
Talk a little bit about what people can expect once the screening is done, what we can expect on our end.
Sure. We get back with them right away with a letter and or their physician calls them or will call them within normal. And if it's normal, then they continue the screen yearly until they fall out of criteria. If it's abnormal, we'll contact that immediately. They get into our process where a group of us will review those scans, decide what the next process is, and again, get us into diagnosis, which is behind me.
Yeah, treatments are getting better for lung cancer. It seems like every year there are new treatments and new advancements in technology. So we're going to talk a little bit more this morning about some of those treatments and what we can expect if cancer is detected, what we can expect our next steps will be.
All right, Bethany, thank you. We'll check back in with her in just a little bit to get more on that. Now, every year, more than 200,000 people in the U.S. are told they have lung cancer. More than 130,000 people die from the disease. That's according to the CDC.